It has reached 12 noon Eastern Daylight Time, and my name is Anthony Quinn. Good morning. I'm the Chief Community Officer of the Canadian Association of Retired Persons. Moses Neimer, the President and Chairman of the Board, has asked me to assume the role of Chair and to conduct the business of the meeting today. Due to the restrictions placed on us as a result of the COVID-19 pandemic, and in accordance with the recommendations of Corporations Canada, and in compliance with the Canadian Not-for-Profit Corporations Act and our own National Bylaw Number 1, we are holding this meeting virtually for the first time. And while this format does present challenges, it also provides new opportunities. We are glad to welcome our largest ever in-person attendance to the AGM. I recognize that right now we have 404 participants currently joining us online. All previous AGMs in our collective memory have had no more than 100 participants. So welcome to all of our members from across the country that are able to join us here today. I want to draw your attention to the documents that we will be referring to in this meeting. There is the President's message, the audited financial statements, and the minutes from last year's annual general meeting. They have been posted in the chat function, and I will ask Lee to copy and paste them a little closer to the bottom of the chat so everyone can see them again. They are also all available on the website carp.ca/AGM 2020. So if you want to refer to the documents there, you're welcome at carp.ca/AGM 2020. For those of you online today, you will have the opportunity to vote on the motions presented using the poll function tool the poll function in the toolbar at the bottom of this Zoom video screen. At the time of the motion, you're welcome to vote in favor, opposed, or abstain. We will allow a few moments for members to cast their votes, and I will announce if the motion is carried or if the motion fails. You are welcome to ask questions of the board in the chat window. Due to the large number of members in attendance, we will collect all of the questions received today and post the answers to those questions, along with a recording of this meeting on the carp.ca website. For those of you who do wish to ask questions of the Board of Directors directly, we will have some time to take your question following the business portion of the meeting and our guest speaker. Please enter your questions in the chat, and I will bring you into the meeting as a panelist so that we can hear from you in person at that time. A reminder that according to our bylaws, members, non-members, directors, and the public accountant of the corporation are entitled to attend and be present at meeting of the members. However, only those members entitled to vote at the members' meeting, according to the provisions of the Act, articles, and bylaws, are entitled to cast a vote at the meeting. Any violation would be in contravention of the Federal Not-for-Profit Corporations Act. So in other words, if you're not a CARP member in good standing, you are not eligible to vote today, but welcome to you all. I now call this meeting to order. We have 476 CARP members in good standing present virtually and 5,962 members participating as represented by proxy. As such, we have a quorum of the members of the corporation present, and I declare the meeting properly constituted for the transaction of business. Among the CARP members present, I want to acknowledge the current members of the CARP Board of Directors in attendance who are currently visible on your screen, and I want to thank them for their work on behalf of the association during this last fiscal year. In addition to the President and Chairman of the Board, Moses Neimer, Moses, wave for now, we also have Moira Cohen. Moira is the Secretary of the Board. She is also the daughter of CARP founders, the late Lillian and Marie Morgenthau. Welcome, Moira. Ramona Captain is our Director at Large representing Western Canada. Ramona is the volunteer president of the White Rock, Surrey, British Columbia CARP chapter. Hi, Ramona. Bill Van Gorder is the Vice Chair of the Board representing Atlantic Canada. Bill has been a volunteer board member and past president of the CARP Nova Scotia CARP chapter and is currently serving as the interim Chief Policy Officer while Marissa Lennox is on maternity leave. Welcome, Bill. We'll be hearing from Bill a little later on. David Kravit is the Treasurer of the Board and our longest tenured member of the CARP Executive, and currently serving as CARP's Chief Marketing Officer. Hello, David. Can you wave and identify? Hello. We are also joined virtually by many of our CARP chapter volunteers from across Canada, some of whom have agreed to help us with the motions on our agenda today. Welcome to all of you. If you could wave, our volunteers, thank you. And we welcome all of you, and we're sorry that we cannot be meeting in person today because of the pandemic. So thank you for joining us this morning. The next item on the agenda is the approval of the minutes from the previous annual general meeting. I will take a motion now to approve the minutes of the annual general meeting that took place on February 27th, 2019. And I'll ask Rick Baker to join us now.
Thanks, Anthony. I move that the minutes of the annual general meeting dated February 27, 2020 be accepted and that the reading of said minutes at this AGM be dispensed with.
Thank you, Rick. Do I have a seconder for that motion?
Yeah. I will second that motion.
Carol Ann. Thank you. There is a motion before the membership to approve the minutes of the annual general meeting of February 27th, 2019, and that the reading of said minutes be dispensed with. Please post in the chat if you have something to discuss related to this motion. I will entertain discussion if I find it relevant to the motion.
It says my internet connection is unstable.
We hear you well, Moses. Hearing none, I will call the vote. Please check the poll that is in progress and vote on motion number 1, that the minutes of the annual general meeting dated February 27th, 2020 be accepted and that the reading of said minutes at this AGM be dispensed with. For my volunteers, can you alert me that you're able to vote?
Yes.
Terrific, thank you.
We can vote, but we can't submit.
Yeah, it doesn't go.
You can't submit.
I voted, I cannot submit.
Oh, you cannot.
We see motion 1 and motion 2.
And if we scroll, we can see all of them. So we cannot submit until we voted on all of them at one time. They should have been done
Okay.
individual polls.
Okay.
Okay, how do we scroll?
Mr. Znaimer, you have been allotted 5,900 proxy votes. I will take a vote by show of hands. All in favor of the motion, raise your hands. I see Mr. Znaimer has voted in favor. The motion carries. Thank you. I now recognize Mr. Terrence Chan. He is the CFO of Zoomer Media and the financial officer of C.A.R.P. Mr. Chan, the floor is yours.
Thank you, Mr. Chair. I present the financial statements ending on August 31st, 2020, followed by the auditor's report. The auditors RSSM LLP Chartered Professional Accountants have issued an unqualified opinion on the financial statements for the fiscal year ended August 31st, 2020, dated January 13, 2021. This report was posted publicly to the CARP.ca website on January 14, 2021.
Thank you, Mr. Chan. As mentioned, the board and Mr. Chan will take your questions shortly following our guest speaker. We will move on to the next item of business. You may also review, as noted, those financial statements on the carp.ca/AGM website or in the link in the chat below. I will take a motion now to appoint the auditors for this current fiscal year. I recognize Sharon Callahan, who is muted. Thank you, Sharon.
I move to appoint RSSM LLP Chartered Professional Accountants as auditors of the corporation to hold office until the close of the next annual general meeting of members or until a successor is appointed, at such remuneration as may be fixed by the directors, and the directors are hereby authorized to fix such remuneration.
Thank you, Sharon. Is there a seconder for that motion?
Larry Duffield, I second that motion.
Thank you, Larry, from the Windsor C.A.R.P chapter. There is a motion now before the membership. Please post in the chat if you have something to discuss related to this motion and state that issue. I will entertain discussion if I find it relevant to that motion. Seeing none, I will ask that you now vote on motion number 2 using the poll function. And for those on the screen, I'll ask for a show of hands. All in favor? All opposed? The motion carries. Thank you. I'll now move on to the next item on our agenda, which is the election of directors. There are 3 positions required to be filled according to our bylaws. I will now take a motion to appoint directors of the corporation. Mr. McKenna and PEI.
I move to appoint Moira Cohen, Ramona Captain, and Moses Neimer as directors of the corporation to hold office for a term of 2 years from the date of appointment or until a successor is elected or appointed, whichever occurs first.
Thank you, Bob. Do I have a seconder for that motion? I'm looking for Gwen Kavanaugh.
Oh, here. Yes, second. I do appoint Moira Cohen, Ramona Catton, and Moses Neimer as directors of the corporation to hold office for a term of 2 years from the date of appointment or until a successor is elected or appointed, whichever occurs first.
Thank you, Gwen, from the Barrie, Ontario chapter. We have a seconder. There are 3 names before the membership for the appointment of directors. I will now open the floor to discussion. If you wish to discuss any nomination, please state which proposed appointment you are speaking to and state your comment in the chat. Seeing none, I will call the vote. Please refer to the poll to vote to appoint the directors for their next term. For those on screen, all in favor, please raise your hand. Opposed? The motion is carried. Thank you to Moira Cohen, Ramona Captain, and Moses Neimer, who are appointed as the board of directors for a term of 2 years. I will now take a motion to approve the acts of all the directors and officers of the corporation for this past year. Call on Fred Harwood from Richmond, BC to help us with this one.
I move that the membership approve all of the actions, including bylaws, resolutions, acts, and proceedings of the directors and officers of the corporation made or taken since February 27th, 2020, as the same are set forth and referred to in the minutes of the corporation or in the financial statements submitted to the members of the corporation on this date, are hereby approved, sanctioned, ratified, and confirmed.
Thank you, Fred. Do I have a seconder for that motion?
Rose Belag, Mississauga C.A.R.P chapter. I second that motion.
Thank you very much, Rose. There is a motion before the membership. Please post in the chat if you have something to discuss related to this motion and state the issue. I will entertain discussion if I find it relevant to that motion. Seeing none, I will call the vote. Please refer to poll number 4. And all on screen, those in favor, please raise your hand. Thank you. All opposed? That motion carries. This concludes the scheduled business of the annual general meeting. I will now open the floor to any new or other business any member of the corporation may have. Please post in the chat if you have new business for the association and state that business. I will entertain new business if I find it relevant according to our bylaws. Seeing none, I close the floor to new business. This concludes the business of the annual general meeting of the Canadian Association of Retired Persons. I will now take a motion to conclude the annual general meeting. I'm looking to Kathleen Spat from Regina, Saskatchewan. Bill, may I ask you to make a motion to conclude our meeting?
So moved.
Do I have a seconder for that motion?
Gwen Kavanaugh, I'll second that motion.
That motion is seconded. Please vote now on motion number 5 using the poll function and submit. Those on screen, please raise your hand. All in favor? Opposed? That motion carries and our annual general meeting is concluded. Thank you all for your attendance and participation, but please do not leave. Your questions are welcome following the introduction and the presentation from our guest of honor, who I see has just arrived on our screen. Mr. Znaimer, the chair and president of the board, I give you the floor to introduce our guest. Moses, you're still on mute. There we are. Welcome, sir.
So, Anthony, in no time at all, I've committed 2 of the cardinal sins of Zoomerdom. I failed to unmute in a smooth way. Can you hear me?
Yes, sir.
Okay. All right. And then, of course, you caught me speaking to people off camera there earlier. So I apologize for my lack of Zoomer etiquette. But I am really very pleased to have the unexpected honor of introducing Jagmeet Singh and welcoming him to our proceedings today because full disclosure, it's unexpected because we set out actually to book Erin O'Toole. And you know all that it's an important tradition at CARP that the leaders of the major federal political parties come to us each year to offer up their ideas for the country and also to address the matters of utmost concern for Zoomers, 16.8 million Zoomers in Canada. So it happened that a couple of weeks ago, I was chatting with Mr. O'Toole. After months of back and forth, we booked something that actually took place only a few weeks ago. And so I told him about the tradition and I offered him the opportunity, and he pretty well accepted right there. But he did hedge appropriately enough that he had to check his schedule and he had to check with his staff. And that's when things got vague. And the next morning when we tried to confirm, we didn't get an answer. And then we're kind of left afloat for about another week. And finally, we got the official no, citing other commitments. Well, okay, fair enough. I don't know if I believe that entirely. And I wonder, is it possible that Mr. O'Toole was actually a little afraid of us? Well, because he knows of some of our policies. And I noted in this morning's headline that he's, for example, opposed to national standards for long-term care, something that CARP has advocated for a long, long time. And I have a suspicion that maybe his staff took him aside and told him about our campaign to get real leadership change in the conservative-run long-term care ministry in Ontario. Anyways, that's my little theory. It may be that our schedules didn't click, and I hope he knows that if ever he should come to talk to us, we'll give him a good and friendly hearing. But so if O'Toole may be a little afraid, Jagmeet is not afraid of us at all. In fact, He's been very accommodating, and back last October, he sent us a very nice video to recognize National Seniors Day, and about a month later, he dropped by one of our chapter congresses, but this appearance is by far his greatest commitment to us. And so I want to welcome him, Jagmeet, if you're still there, and thank you for being a very good sport for accepting this very late invitation. Jagmeet Singh is was educated and practiced as a lawyer. He ran for office unsuccessfully the first time federally, picked himself up, ran again provincially, succeeded. And then when Tom Mulcair stepped down, he became the leader of the National New Democratic Party. I give you Jagmeet Singh.
Thank you very much, sir. I'm really honored to be here. Thank you, Mr. Znaimer, and thank you to all the members of CARP for the incredible honor. I don't know why anyone would pass up an honor to speak with so many active voting members of our society who care deeply about making this community and this country a better place. So I would never turn down such an opportunity. And thank you again for the immense honor. I get 2 chances to speak to you. I want to start off by just acknowledging Mr. Znaimer's great work, CARP's great work, your advocacy. You're speaking with a powerful voice for people who sometimes get ignored, and seniors, particularly in long-term care, often don't have a voice, which is ironic given seniors in general are very active and participate in voting. That seniors would be ignored in long-term care is a travesty. So I'm honored to be able to talk with a group that is so engaged. I want to also just take a moment to reflect on how COVID-19 has really devastated our country and the world in a lot of ways. And it's hit people in so many different ways. Directly, we all know people who've lost their jobs or even their businesses as a result of this pandemic. We also know that it has impacted families, children going to school, seniors, people living with disabilities. But what I believe, I feel you might agree with me, is the most heartbreaking part of this pandemic is how COVID-19 has impacted seniors living in long-term care, how seniors living in long-term care have borne the brunt of this pandemic. It is just, it is a shame that that's happened. I have to say though, in all of this, the difficulties that we're going through, I've been really proud of Canadians coming together and caring for one another, the response that Canadians have shown. We've shown that in hard times, we take care of each other. But the pandemic has also shown that when governments don't make the right decisions, there is a cost of government neglect and inaction. Existing problems and crises have been made worse because of that neglect and that inaction. We saw that the government's response was not adequate. And so our goal has been throughout this pandemic to fight for people and to fight to make a difference in the lives of people. We see millions of Canadians lose their jobs. Many have not been able to return to work. Many simply can't. When the pandemic hit, we knew that this would be a serious issue. And I put the question directly to Justin Trudeau. His initial response was just to make it easier to access EI by waiving one of the week of requirements in terms of application. We said that wouldn't be good enough. So we fought to make sure people got the help they needed, direct supports. It was introduced at $1,000. We doubled that amount to $2,000, which for nearly 8 million Canadians was the difference between putting food on the table and paying the bills and not being able to do so. Students were left out, and we fought for them to get direct help to students, and were successful to get that help. He left out seniors like many of you, and we fought for you to bring in supports for seniors. This is something we committed to. The Liberals decided to only go with a one-time payment only, which we think is inadequate, and we're going to continue to raise awareness of that. The Prime Minister left out people living with disabilities. We fought for them, and we were able to obtain some supports for seniors, for people living with disabilities. And he refused to provide paid sick leave, which experts say is one of the most important tools, not only to help seniors in long-term care, but to help workers not transmit the illness, as workplaces have been seen to be one of the largest causes or places of transmission. So we were able to fight to establish the first of its kind paid sick leave at the federal level in our country's history. And a number of times, Justin Trudeau tried to cut the help that people received, and we were able to push back and keep the fight going, or keep the support going. I'm proud to say that with the biggest, I feel, impact that we've seen being seniors in long-term care, we announced our plan to offer a care guarantee, a guarantee for seniors to receive the best care possible. We know that most of the lives lost in this pandemic were seniors in long-term care. We believe deeply that seniors deserve to be cared with dignity. Canadians were shocked and stared in horror as the army was called in to long-term care homes, and the report outlined some very horrible, appalling conditions. And we know that this problem can be attributed to cuts brought in to healthcare from conservative and liberal governments that have absolutely starved our healthcare system of funding. But we know specifically there needs to be more funding for long-term care, and there also needs to be standards of care. But one thing has been very clear. The evidence is overwhelming that for-profit has made things worse for seniors, has made the care for seniors worse. So profit should have no place in our healthcare system, but certainly no place in the care of our seniors. Some of the long-term care providers, as you know, received public help from the government, but ended up paying out millions of dollars in dividends and cut the help that seniors needed in the most crucial and critical times. This is completely wrong. So our plan is to remove profit from long-term care, starting with Revera, which is owned by a federal agency. The federal government has complete ability to make that public. We want Revera to no longer provide for-profit care. As a second largest provider in the country, this would dramatically improve the care that seniors receive, many, many people receive. We want to fix the overall broken long-term care system. And to do that, we need commitments to seniors that they are going to receive safe, dignified, respectful care, both at home for home care, as well as in care homes. We want families to be rest assured that their loved ones will be cared for, that there's inspections, that there's appropriate levels of care and staff ratios. And we want a commitment to workers that they know that they're going to get a good wage with benefits, safe and secure jobs, because we know that the quality of work is directly related to the quality of care. If there's inadequate hours, inadequate staffing levels, if workers don't earn enough to work in one home, it directly impacts seniors. Our plan is to work collaboratively with patients, caregivers, and provincial and territorial governments to develop national care standards. We absolutely believe we need to learn from this pandemic what worked and what didn't work, and what are the best practices, and gather those together to establish what those best practices are. We need to ensure that there's accountability mechanisms. We want to make sure that the standards and the quality of care are tied and backed by stable funding. We want to invest an additional $5 billion in long-term care systems across the country, and make sure that our funding is also tied to the principles behind the Canada Health Act. We know that seniors deserve this. The cost of inaction is too great. This is a commitment and an investment we need to make. We've also talked about how we look at long-term care funding compared to other countries, and we are doing far worse than our colleague countries or countries we can compare to. Our funding for long-term care falls far too short. There's a number of other issues that we're dealing with, and I want to touch quickly on vaccination. Vaccination was seen as this light at the end of the tunnel, this opportunity of hope when people were feeling so worried and so afraid. This was that moment when people thought, if we get vaccinated, if we get the vaccine, we will get through this. But Canada is falling dangerously behind other countries in our vaccination efforts. We see the United States and United Kingdom are vaccinating hundreds of thousands of people every day. And despite their own challenges, they're exceeding their delivery in a way that we cannot be falling behind. We're seeing very serious concerns that are starting to erode public trust and confidence in the vaccine procurement and delivery. So we need to see more transparency from the government, providing us details around what was negotiated, what the contracts were. The premiers are requesting the details of the contract. We agree. We need to make sure that the vaccine is produced locally. This is vital. If we cannot produce the vaccine locally, we will always be at the whims of international logistics and international production, which will mean Canadians do not get the vaccine supply that we need. We need a successful mass national vaccination campaign and enlisting everyone and anyone who's able to vaccinate or to provide the vaccines to be a part of this effort. We know that there has been some finger pointing, but the Prime Minister, the federal leader, is in the best position to provide leadership to ensure provinces and territories can all be on the same page to deliver the vaccine. We need to have confidence restored in the vaccine delivery and procurement, and we need to see some strong initiatives and strong steps to achieve that. While we are right now focused in on the pandemic, long-term care, and vaccines, there are still a number of things we need to work on in addition to that. And so I want you to know we are going to continue to focus in on expanding our healthcare system to cover people from head to toe. And that includes pharmacare, which we know has become even more of an issue as workers lost their jobs, they lost their benefits, and even more Canadians can't afford their medication. We're the only country in the world that provides universal health care that doesn't provide medication coverage. We know that this would be an investment that would save all levels of government money. It would be a proactive way to ensure people who are sick are able to either cure their illness or maintain their health so that it would cost our healthcare system less in the long run. We also know that dental care was always envisioned to be a part of our healthcare system, but you could go into a hospital or go to a doctor and treat a complicated heart issue, a surgery for your knee. But if your teeth are in need of care, that is not available. And it simply makes no sense. We also want to increase income supports. We know that for a lot of seniors, they simply don't have enough income to be able to live with dignity as they age. So we want to, the Liberals have still not fulfilled their promise to increase OAS to people over 75. We believe it should never have been just people over 75. It should be, as OAS starts, it should be increased. We know that the amount of OAS is not enough for people to live with dignity and needs to be increased. I refuse to accept that it is okay that any senior in this country lives in poverty, and New Democrats are going to propose something concrete to fix this. We will have a plan around lifting the amount of supports that lifts seniors out of poverty and provides them with enough to live with dignity. And a lot of questions, very fair questions, are coming forward around how we're going to pay for all of this. This is very costly. And I understand it's very important to be prudent about how we spend our resources. And our budget right now looks very troubling to a lot of people. And I understand that. What we've seen, though, in this crisis is that working families have struggled, small businesses have struggled, but some of the wealthiest in our country, the wealthiest billionaires, 44 Canadians that are the wealthiest billionaires, have increased their wealth by a cumulative of over $62 billion and counting. $billion and counting. We know that some of the wealthiest companies in the world have made massive profits in this pandemic, and many of them pay no taxes, virtually no taxes in Canada. I'm thinking about the Amazon, Netflix, Google, and Facebook, which make profit here in Canada, but don't pay taxes here. We know that tax loopholes mean that companies that make profit in Canada can take that profit and hide it offshore and shield their profits from ever paying their fair share in Canada. This is a system that was designed by the parties of Justin Trudeau and Erin O'Toole, and we think they're incredibly unfair. So we believe that those who have made billions off of this crisis should also contribute more. Much like we did in the wartime, there was a profiteering tax. And it wasn't that some companies purposely profiteered, but if you were in the right place at the right time and your profits expanded tremendously, then you have a responsibility to contribute back more. If you've made money off of this pandemic, then you should have a responsibility to contribute more. And we're talking about the large corporate grocery stores, the large and wealthiest companies that have made massive profits. Amazon has increased their wealth astronomically. So there should be a pandemic profiteering tax to ask those who have the ability to contribute a bit more. We still believe that on fortunes of over $20 million, the top of the 1% should be contributing a little bit more. And we can do so. We are the only party that has put this idea forward, and the Liberals voted against it, the Conservatives voted against it, and the Bloc voted against it. We also know that we've got an opportunity to build back. It's hard to imagine, but once we get through this pandemic, there will be an opportunity to build back. But when we do so, we can't go back to some things that weren't working. We've got to change things that weren't working, and we have to build back better. And building back better means that we've got to build back better for everyone. We can't go back to a healthcare system that didn't cover everyone and where making money was more important than caring for our loved ones. We can't go back to a time when people who are sick could not stay at home. And we have to ensure that people can stay home when they're sick, that there is paid sick leave. And we can't go back to a time when people who didn't have enough work or enough money were left to figure it out on their own. We need to provide the right supports. One of the lessons we've learned from this pandemic is that we are better and we are stronger when we take care of each other. So my commitment to you, to Canadians, is that New Democrats will keep on fighting for you. Just as we have done every day of this pandemic, we are going to continue to fight for you and your families. Because you elected New Democrats and because they were there for you, we were able to provide the supports that you and your families need. We won't stop fighting for your families, for your health, and for a brighter future. We will keep on making sure that Parliament works for you. Thank you so much. C'était vraiment un grand plaisir d'être parmi vous aujourd'hui. On va continuer de se battre pour vous. Thank you so much, and I'm ready for any questions you might have.
Thank you very much, Mr. Singh, for joining us this morning, this afternoon. And I want to apologize to my colleagues. I jumped ahead in the agenda. I got excited when I saw you came on and I went right to you. So I do apologize. I did step off of our plan. So I'm going to ask that you hang on, and Mr. Bill Van Gorder, the Chief Policy Officer at CARP, has the focus for our 2021 advocacy. And I think there'll be a lot of common ground. And Mr. Van Gorder, if you could lead us in your presentation, and then Mr. Singh will take questions for the entire gang on these important issues. That's all right with everyone? Thank you, sir. This is Bill Van Gorder, Chief Policy Officer at CARP.
All right. Thank you, Anthony. You can hear me all right?
Yes, sir.
Thank you very much, and welcome to all of you across the country. Almost 600 people last time I looked, and good to be able to talk to the entire country. This afternoon, I'm going to review some of CARP's advocacy priorities for 2021. Your chapter leadership across the country will be receiving all of this in much greater detail. And of course, priorities do change as new topics and circumstances come up. So we will remain flexible to respond in as many areas we can. And of course, as always, our local chapters look to local issues and focus on them as appropriate. The national priorities at this time for CARP for next year will include, of course, long-term care, home and community care, financial security, older adult fitness, and a watching brief on a number of other issues. But to begin with long-term care, we can't ignore 80% of all the COVID deaths were linked to institutional care last year. Like you, CARP leadership has been shocked by that. But in spite of the terrible occurrences in long-term care, we will also be focusing on what we see as a continuum of long-term care. Long-term care is not just facilities. Long-term care begins when, as we get older, we begin to need some extra help to live well, either for our health or our home and where we are. And it's a continuum that moves through needing more medical services, supports in our homes, in our community, through the stages of increased care, which would move through perhaps long-term care facilities and eventually into hospital care. So CARP's progression is going to be looking at the entire process, including long-term care facilities, but with an emphasis on the care that older Canadians require in their own homes and their communities. But before we get to home and community care, we do want to talk a little bit about long-term care. Canada spends 1.3% of its gross national product on long-term care. 37 other OECD countries, countries like the Netherlands, Norway, Sweden, spend 3%. That's twice as much as Canada spends. Long-term care has to be completely built from the ground up. Governments have to realize that large facilities that warehouse our seniors are not the way we want to treat our loved ones. So CARP will engage the federal and provincial and territorial governments to challenge them to improve and standardize long-term care. CARP will ask the federal government to play a greater role in setting the tone for the long-term care system. We don't accept the fact that for some historic reason and arguing with the provinces, they have to stand back or play ping pong with our older adults. Both must come to the table equally and work to the same kind of goals. Now, in many provinces, not for profit long-term care is at fault. What we're finding and what we're seeing is the problems that aren't between for-profit and not-for-profit. It's not who runs it, but how it's run. CARP is going to demand regulations and standards for all long-term care facilities, standards and regulations that are monitored and enforced. Without monitoring, without enforcement, it's not going to happen. And if it's properly monitored and enforced, then it won't matter who's running it if it's being run properly. You know, the mandate letter that the Prime Minister Trudeau sent to the Minister of Seniors and the Minister of Health said that they should work together to make sure that seniors get the best possible support. Well, CARP's going to hold their feet to the fire on that one. Long-term care, as we said, needs to be completely rebuilt from the ground up. We expect to see improvement in staffing levels, in infection control training, in access to personal protective equipment, and the condition of those aging and outdated facilities. Well, let's move on though to home care and community care. We will, as I said, continue to show concern for long-term care, but we really believe the true answer is in better home care and community care. Remember, only 5 to 8% of older Canadians live in long-term care. The other 90 to 95% live in their own family homes, in apartments, condos, senior residences. And across Canada, and even within individual provinces, there are gross inequities in services, facilities, and even the common definitions of how we work. As I said, we only spend half as much on long-term care as other comparable countries, and we only spend as 10% of long-term care budgets on home and community care. 95% of the older adults live in the community. Only 10% of the money is spent on their care. That has to change. Home and community care is underutilized and poorly funded. And home care services, you know, aren't publicly insured to the Canada Health Act in the same way that inpatient hospital and physician services are. So no wonder they get the short end of the stick. In Canada, most home and community care services are delivered by provincial, territorial, and even municipal governments. And a large portion are family funded by our families ourselves. In 2017, the federal government designated $6 billion over 10 years to invest in more home and community care. We're asking, what happened to those dollars? Both the federal ministers of health and seniors were told that they should do something about it. CARP will be watching, commenting, and demanding action, not promises. We're tired of promises. We want action. The pandemic has shown that home care and community care based solutions are critical, and CARP asked the federal government to financially support, tied to national standards, the need to meet those critical needs. But their money has to be accompanied by national standards, and we're tired of the excuse, well, that's a provincial area. In the next year, CARP will push for more funding for frontline home care, better community care and respite care, increased nursing hours, expanded telecare solutions where they're appropriate, and the understanding that telecare is not appropriate for all seniors, and providing tax income rebates for family caregivers, an area that's been ignored much too long. The standard and level of care across our countries shouldn't be determined by our postal code or our ability to pay. All Canadians need home and community or facility care, and they should all benefit from the same high quality of service. As I pointed out, in Canada, we only spend about 10% of the long-term care budget on home and community care, yet 90 to 95% of our seniors are at home. That's just wrong. Home and community care services are underutilized, poorly funded, and difficult to access. One of the issues is that home and community care services aren't insured like those hospital and physician services. Family-funded home care should receive a tax credit in recognition of the costs that families face to assure the security of their loved ones. And that saves the government money too. So Canadians are expecting, and CARP will continue to fight for all those changes. CARP's next focus will be on the financial security of older adults. You know, despite the health concerns, when we do our surveys of CARP members and other old adults across Canada, one of the very top issues all the time, and sometimes even before healthcare, is their worries about their financial future. The COVID pandemic has increased the financial anxiety of many of our members as they see their expenses rise against their fixed incomes. Many CARP members fear that the economic disruption is going to put their retirement savings at risk. As a COVID relief, seniors received an OAS top-up of $300 for those eligible, and those who were had particularly less income got another $200. $500 in total for some, $300 for most. Other segments of the community received thousands of dollars. Patently unfair. CARP will hold the government, the federal government, to its election promises of boosting the old age pension by 10% for people 75 years of age and older, and increasing the Canada Pension Plan survivor benefit by 25%. We want the elimination of the mandatory retirement withdrawals, so seniors don't need to deplete their nest eggs before they need to do it. We want legislation that better protects senior investors. We want a full tax benefit for people on the CPP disability pension, and we want safeguards for pensioners when companies go bankrupt. Surely that's very little to ask on behalf of those who have contributed so much to the country, yet see their finances dwindling even more so during COVID. Older Canadians are one of the most financially vulnerable populations in Canada, especially those who live alone. Pensions have to be protected. We have to close the loopholes that allow company pensions to be reduced or eliminated due to bankruptcy. The next area we're going to concentrate on is older adult fitness. As you'll see, Moses reminded us in his written report, which I hope you've all read, we CARP members have a personal responsibility for our own health. Usually we're advocating to others. In this case, we're advocating to ourselves. Moses' call was for us to stand up or sit up straight, move our buns, and preserve our minds. Well, that's more important than ever before. You know, if we could be assured of one pill, one medication that we could take to add years to our lives, wouldn't most of us take that medication? Well, there is such a pill that'll add years to our lives, and that's looking after our own health and especially our own fitness. And we have to take our own responsibility to do that. Now, CARP wants the government to invest in ways to help us do that. The federal seniors tax credit was canceled back in 2017. CARP wants public health dollars focused on older adult fitness, like a fitness activity tax credit. And local recreation departments need to focus more on older adults and not realize they're not just there to offer hockey and baseball to the kids in the community. What we need is a federal government seniors fitness action plan. And here at CARP, we're going to take our own action. We're going to re-energize and facilitate our peer support walking program through our chapters. Walking, with or without poles, for you who know those who know me, walking with or without Nordic style poles is one of the best fitness activities for any older adult. Well, I've talked about 4 of our fitness advocacy priorities for 2021, but we will continue to hold a watching brief on a number of other areas. And in your own province and in your own local community, we know you will find issues that have to be addressed to prevent the creeping ageism that we're witnessing across the country propelled by COVID-19. We'll continue to fight the creeping reemergence of ageism and return to our priorities of last year at this time, the Fix Healthcare campaign. We'll advocate for better education, support, and management of areas like the best available vaccines, such as the high-dose flu vaccine that provide best-in-class evidence-based resources that provide quality information for both older adults and caregivers to help them better understand the benefits of vaccinations of all kinds as a part of good preventative health. We'll be continuing to educate and call for better access to medical cannabis and have us all understand how medical cannabis can help us as we grow older. We want to look again at the areas of eye care, oral health, and hearing care, all areas that seem undervalued by our system, but proper oral health, mouth care, being able to see properly, be able to hear properly are huge issues with seniors that seem to be ignored more and more across the country. And seniors' mental health has really been impacted by COVID. We need much more attention to seniors' mental health. We're seeing many more dollars going to youth mental health, and that is certainly important. But in doing so, we seem to forget how the impact of COVID and the impact of isolation has created mental health problems among our seniors. And of course, we want equitable access across the country to the best pharmaceuticals. A national pharmaceutical program, national pharmacare. We're not looking for the cheapest program. We're looking for the best program that will service all Canadians and especially our older adult CARP members. Well, I firmly believe that the effectiveness of CARP advocacy in the next year will be enhanced by the energy of our staff, the dedication of our volunteers, and the active support of our now 325,000 members. So I urge you to invite your family and your friends to join us to make CARP's new vision of aging the better future for Canada's older Canadians. Thank you.
Thank you very much, Bill and Mr. Singh. Thank you for tuning in to hear CARP's plans for 2021 and our advocacy. We do want to take some questions from Mr. Singh or Bill. And if I could ask any members of the board or our chapter volunteers from across the country who are on our screen, if they wanted to raise their hand first to ask a question, and then we will look into the chat where we've had dozens and dozens of great questions from participants. And right now we're looking at over 600 people on the line right now. So thank you to everyone for joining us, and we'll start with questions now. Rick, did I see you put your hand up? Rick Baker in Ottawa. Yes,
Thanks,
sir.
Anthony.
Rick Baker is the chair of our Ottawa CARP chapter.
Mr. Singh, I really want to thank you for showing up today. I think it's very critical. In your particular role, your party holds the balance of power. Do you predict that there will probably be a federal election this year based on all the non-compliance of what you say happens with the Liberal Party, but even more so in terms of what's happening with Conservative government?
Thank you, Mr. Baker, for the question. And just a clarification, should I take each question one at a time?
Yes, sir. Thank you.
Okay. Thank you, sir. And thank you, Mr. Baker, again. Yeah. So I wanted to be very clear on this point. What we saw, and I'm sure some folks might have noticed this, before the new year, in around November, December time, there was a opposition day motion brought forward, and that is a normal thing. Opposition day motions are brought forward. But what was very unique and not normal was that the Liberals and Justin Trudeau deemed that the vote on the opposition day motion would be a confidence vote, which is I don't think that's ever happened in the history of minority governments in Canada. Doing that made it very clear that Justin Trudeau was looking for an excuse to go to an election. I felt that it is a wrong thing to do in the middle of a pandemic when people need help and support. We need to procure the vaccine and deliver the vaccine. I voted against going to an election. I did not want to give Justin Trudeau an excuse to go to an election when that's what he was looking for, and he wanted to blame the opposition. We've been able to fight and secure some really massive wins for people throughout the pandemic, and we want to continue to use our position in this minority government to do that. So I will continue to say that this is not the time to go to an election, that Justin Trudeau should focus every bit of his effort on securing the vaccine and on delivering the vaccine. That really should be the primary focus right now. But it does look like that instead of doing that, instead of focusing on the vaccine, he is gearing up for an election. There's been comments made to his the National Party had to be ready for an election, and he's been dropping various signals that is what he's intending. If he does so, he will have to do so on his own. I will not be contributing to any excuse to go to an election, but that does look like what he's doing. In case folks are wondering, though, we are in a great position to fight an election. We've paid off our previous 2019 and, in fact, our 2015 debt. We've got money in the bank. We're ready to fight an election, but I don't want to do that. I don't think it's the right thing to do right now.
Thank you.
Thank you, Mr. Singh, and thank you, Rick. Ramona or Bill, did you have a question from the board?
It's Ramona Captain here, White Rock, Surrey in British Columbia. I've noticed that in the chat box and in the Q&A, a lot of people are asking about, what CARP's stand is. And I think Bill pointed out very clearly what we're doing in the following year. But for those who would like to see exactly, please go to www.carp.ca, and all our advocacy issues are there, plus everything that CARP does for members. There's also great benefits. And one person asked in the Q&A, why should I join CARP again? And my reply to that is, the more voices we have, we can go to our NDP leader like Jagmeet Singh, and we can go to all levels of government with a loud, clear voice, and it's membership that does that. So please don't drop your membership. It's very, very important. That way we all have a voice. Thank you.
Thank you, Ramona. Fred Harwood from the Richmond Delta CARP chapter had his hand up for a question.
Thank you. I would like to raise a question from Janice Daly in the chat. I thought it was very appropriate. She's asking about dental care, as a neglect of dental care creates more serious health problems. And especially during COVID, where we've got so many people afraid to go out. Her question then is around, why is there not more emphasis on preventative care in Canada?
Mr. Harwood, thank you so much for the question. I appreciate that, and I absolutely agree. Even pharmacare, if you look at pharmacare, one of the big arguments for it is that people who are diagnosed with an illness and then can't afford to take the medication or think about taking less dose or cutting pills in half, all of which happen. I'm sure you know of stories where this is going on. By not taking the medication they need, people then get more and more sick, more and more ill, and end up in the worst stages of an illness. And as we all know, the worst stage of any illness is more costly to cure. And it's harder on the person, of course, individually, but harder on the healthcare system. So it's preventative to take medication. And dental care is absolutely connected to our overall well-being. If you can't eat well, we know nutrition is so vital to health and to well-being. And if your teeth are hurt, your teeth have issues, there's no path for someone to get dental care. You could go in to a hospital with pain in your teeth and get painkillers, but not actually get treatment. And that really makes no sense. So I absolutely believe, as an approach, dental care, pharmacare, these are proactive ways to prevent further illnesses. But we also need to look at, as your chair of policy indicated, Mr. Van Gorder, investing in making it easier to exercise and be physically active. Though it's sure there's a personal responsibility, but we also have a way to encourage I've heard this saying that if you make the healthy choice the easier choice, people will take it every day. And so we need to make the healthy choice the easier choice. It's easy to get active. It's easy to go to a community center and find programs to be active. And so right now, the healthy choice is not always the easiest choice. And so for many reasons, I absolutely agree in preventative measures, investing in healthcare to keep people well. It shouldn't just be about curing an illness. It should be about making sure people are healthy to begin with.
Thank you, Mr. Singh. Mr. Van Gorder mentioned in his presentation that the important thing for CARP in the face of long-term care was that whoever is providing the care do it properly. And we have a question from a member named Julie, and she asks, if there's not-for-profit long-term care, then who will be running these current private long-term care sites? How do we transition, in your party's view, from a shared model to a public-only model?
Right, and I should note what we want to do specifically is remove the for-profit, but there are many great not-for-profit run long-term care homes. When the goal is not profit, so not-for-profit or public, then we've seen the evidence has shown that more of the investments or all the investments go towards the care. One of our big concerns is if we're spending, and someone mentioned this in the chat as well, if we give $1 to long-term care and it's a for-profit home, well, there's a portion of that that's not going to go to senior care. It's going to go to profits. It's an extra margin. And that's a problem. But I take Mr. Van Gorder's point very well. No matter what happens, we need to make sure that there are standards of care that are being met. And that includes standards of hours of care, levels of staffing. And in terms of who governs it, we're faced with a similar problem to when we brought in universal health care. At that time, of course, it's a provincial jurisdiction, but it was federal leadership that helped us get to a point where we had universal health care. Tommy Douglas's vision, the New Democrat vision of making sure everyone had health care, was something that the Canada Health Act contributed to, a number of steps contributed to, and we had private hospitals that we had to contend with and we wanted to remove. And so the Canada Health Act was instrumental in getting rid of them. At the end of the day, when it comes to healthcare, my value is people should be put first. Our seniors should be put first. And any way we can possibly achieve that is our goal. We're a strike a task force to look at the various ways where we can increase funding for public delivery or not-for-profit delivery of that long-term care.
Thank you. Bill, I saw you, I think you were going to open your microphone there, Bill. Did you have a follow-up question for Mr. Singh? No, sir. All right, then I look to Ron Swan. He is the chair of our CARP Nova Scotia chapter. A question from the Atlantic provinces.
I'd just like to say that CARP Nova Scotia, our Health Advocacy Committee is working currently on a position paper in home care in this province, and we've got some very, very well qualified individuals working on that paper and that have been involved in home care, both in delivery and lived experience with taking care of parents that are currently at home and now in long-term care and so forth. So I just wanted to, on behalf of Nova Scotia, advocate as to how important that is, not just here in Nova Scotia, but right across the country.
To the moderator, I wanted to add one point. One of your members, I believe it was Ms. Captain, mentioned the importance of joining CARP. As much as I'll tell you this from the perspective of a leader, one of the powers of CARP is the membership. And I'm stepping out of line to advocate for you, but having a large membership does have a lot of weight. And anyone who is in any way smart politician will acknowledge the power of that membership and wanting to speak and wanting to speak with you and hear your concerns. It is actually very convincing. And there are power in numbers. So I just wanted to mention that was a very powerful point brought up, and there might be a time when I'm Prime Minister that CARP will have a concern with me, and me advocating for more membership might turn back on me, but I think that's right. I think if you have a concern, you should bring it up to me and I should be able to answer and be able to respond. So there is power in numbers. Just wanted to add that in.
Thank you so very much.
Thank you. We'll note that when Mr. Trudeau was the leader of the third party, he attended a CARP AGM and he went on to become the Prime Minister in the following election. So thank you for attending our AGM, and perhaps you'll have the similar outcome. I wanted to just to nod to Moses. Was there something, Moses, that you wanted to add about the membership and the voice and the role that we play in making these political changes? Sorry, Moses, still on mute. There we are.
Here we go. It never fails. I was in the process of saying that I was very glad to have the question of membership brought up, because we do get lost sometimes in
we have,
and we thank Jagmeet very much for endorsing that idea, that we have a right to place in high priority the task of growing our numbers. And we're going to try and live up to that command, Jagmeet. Thanks again. I'll be calling when you're Prime Minister.
Look forward to it.
I believe we have reached the allotted time for Mr. Singh's participation. Perhaps I'll ask Mr. Van Gorder just to thank him and to let Mr. Singh know we'll share every question that we've received in our Q&A. We'll be answering the CARP portion, and we'll share the questions directly with you that we didn't get to based on your remarks, and we'll encourage you to respond to them, and we'll post them on our website. So over to you, Mr. Van Gorder.
Thank you very much, Mr. Singh. And as both Moses and Anthony have said, we very much appreciate you being with us today, the frankness of your comments and your willingness to answer questions. And I can assure you that we will continue to be in touch with you, and we'll make sure you and your staff are aware of all the details of our advocacy requests and the backup and data that we have, and hope that we can continue to look to your support. And also I want to, as I believe I said to you when we spoke last fall, I am very much impressed by your knowledge of our of our concerns and appreciate the fact that you do seem to understand what older adults are feeling across Canada, and just hope you're able to cross those barriers, especially that terrible barrier between federal and provincial governments that leaves us caught in the middle, that has to be broken down so people get the health care they deserve no matter where they live. So thank you.
Absolutely. Thank you very much. And I really appreciate I was going to mention something about the questions. I wanted to respond to them. So I'm very thankful that you'll send those my way. And it's my honor to be able to speak with my elders and people that we should respect and care for. And I will commit to doing my best to do that. Thank you.
Thank you.
I see lots of applause on there. Thank you very much, Mr. Singh. And just to alert you, if you wanted to stay tuned or turn your camera off, we have our next guest coming on now is Miss Moira Welch. And Moira is the investigative journalist for the Toronto Star, who has uncovered many of the important stories on the horrific conditions in long-term care across Canada. And Moira is joining us in support of her new book. It's called Happily Ever Older: Revolutionary Approaches to Long-Term Care. And I wanted to welcome Moira, ask that she unmute her microphone. There she is. Welcome to the CARP Annual General Meeting, Moira.
Thank you so much. I'm so happy to be here.
We're very glad to have you. We've read many of your important articles and exposés of the horrors of long-term care across, I guess, in Toronto for the majority of the stories. But you have written a new book about alternatives to long-term care based on models that you have seen working in other jurisdictions. So we're welcoming you, as this dovetails nicely with what we have presented with our advocacy initiatives for 2021 and the fight we've been fighting for decades, following on Mr. Singh's presentation of the NDP policy and call to action for long-term care and what his party would do were they the decision makers. But let us know what you've found in your travels and your studies on alternatives to the models of long-term care across the country, and tell us a bit about what we can find in your book. We're going to continue to stay on the line with you and have a conversation about not comparing one to the other, but the models that you have found to be most successful around the world.
So my book is called Happily Ever Older, and it's a book about hope. And I am inexplicably publishing this in the middle of a pandemic, which was not ever anticipated when I started this in 2018. But the reality is that these issues existed long before COVID arrived, and they will continue once COVID is under control. So the homes and programs and philosophies that I saw across North America and into the Netherlands, I visited all of these places and met all of the leaders before COVID arrived. So thankfully, I was able to travel and meet these people. What I found was a similar DNA, even though some of the philosophies may be slightly different or the design of the homes might be a little bit different, but the purpose and the goal is to allow the resident to live a life based on their individual needs and desires. So to have a life of spontaneity, to have a life where you can go outside, have the freedom to go outside, even if it's in a safe place, and feel the sun on your skin, because so often our elders are locked into a long-term care unit for years, basically without ever having the option to really spend any time outdoors, especially in nature. I found homes where people are really, really pushing forward with the concept of inclusion for people with dementia. The rights of people with cognitive decline are really coming to the fore. And that was very, very interesting. And that is really growing. I found that most of the innovation was around dementia care, but that also improved living for everyone with or without cognitive decline. And generally, the homes that I saw gave individuals simply the freedom to exist, to explore their own interests, their own purpose. There are goals, for example, in a philosophy called the Eden Alternative, and those are to eradicate the loneliness, boredom, and helplessness that most people feel in long-term care. And while that is specific to Eden Alternative, I think it really is part of the growing philosophy in all of these homes. It makes a difference in the way people live. another big piece of this, and I think this is really, really important moving forward, is the relationship between the residents and the staff. And in the homes that I visited, the residents had very deep, I don't want to say familial, but very, very close connections with the workers. And because there's such a shortage of long-term care workers right now, that makes a real difference in their lives. These workers have a sense of value in the work that they do. They are treated very well by the homes. They might be the frontline workers, but there's a flattening of the hierarchy. So they're not considered at a lower level than some of the other staff. And so that really creates a workplace where there's a lot more retention of staff and fewer sick days, and just greater relationships between the workers and the residents in the homes in which they all spend a great deal of their lives. So I will stop there for more questions, but thank you.
Thank you, Moira. The Ottawa CARP chapter, I'm sure, will weigh in. They have presented recently to the Ontario Commission looking into the long-term care situation and had highlighted the need for what was, Rick, I'll ask you to tune back in there with your, unmute yourself, but they had looked for a change to the entire way that long-term care is presented. Rick, can you just give a summary of what your chapter is working on?
Well, thank you, Anthony. And thank you, Moira. I got a copy of your book. It's excellent. I really appreciate it. Yes, Ottawa has submitted to the Ontario Commission a report on transformation of long-term care homes. And it really does highlight a lot of the concepts that were presented by Moira in her book. But I think most importantly is the reach out that we've done to other chapters in Ontario and hopefully other chapters in Canada, and the push that we need to continue to do to make sure that the issues that have been outlined very carefully in the book, but also with our policy people in Toronto, is the importance of us to continue to lobby and advocate different levels of government to make sure that people in long-term care are well taken care of. And these alternatives that are presented really do make sense because they talk about efficiency and the importance of good operating organizations. So that basically gives a highlight. Thank you for the opportunity to talk about this. We're really committed, and our leader, Kathy Wright, has been doing a fabulous job with her team, and we're going to continue to reach out to both CARP National and all the chapters in Canada. Thank you.
Thank you very much, Rick. And Moira, maybe just to add to that and looking to some of the examples you provide in your book. You mentioned the Dutch model and the butterfly effect and other jurisdictions that have integrated that transformational changes in long-term care. Can you highlight one or two of the different models that you've come across and if and how you think they would work in the Canadian situation?
Absolutely. I think all of them would work in the Canadian situation. It just takes the will to do so. And I'll give the first example is the one that I started with in 2018 when the story for the Toronto Star. And that's actually just to say the reaction from readers to that story. It was an investigation into the positive, we called it. And the reaction, the elation that people felt knowing that there were possibilities out there is actually what inspired my book. So I saw butterfly in the Ontario jurisdiction, but also down in Atlanta as well. And all homes do it differently. But again, from what I'm hearing from the leaders in Ontario right now of butterfly homes, they're finding major differences in terms of no more weight loss. They say that the behaviors, so-called behaviors, that people ascribe to those with cognitive decline have diminished almost completely, if not completely. And when I say behaviors, a lot of the people in my book who are experts in dementia care say that this is not indicative of people with dementia necessarily. It's mostly the fact that they're bored. They're sitting in a chair staring at the floor for most of their days. very frustrated in a large institutional setting, big lights, lots of noise. People are afraid, so they react accordingly. And I think most of us would get fairly agitated after a while if we had to sit in a room and stare, at the wall or the floor and have, a scheduled balloon toss, at 11 o'clock every day. And so that has transformed itself completely. That is gone, that kind of model of care, that old task-focused model of care. And so these homes are now operating in very close family units, small households, which are actually very good for infection control. They're very isolated. Only the workers, they're dedicated workers to that household, and the family members play a significant role in the care and in the operations, so to speak, of the home as well. So that's one example that people who are using this model seem very happy with. Another example, I'll give you Dehogevik just in this town of Weesp, just outside of Amsterdam. That is more of a village example. And so that is a very large, fairly large area enclosed with walls, but people are free to come and go from their very small homes of about 7 residents. And they go for walks, they can go out and garden. There's an outdoor cafe they can sit in. There's a little shop. Just like all nursing homes seem to have a tuck shop or something of that nature. This has a bigger version of a store. So you can go perhaps with the caregiver from your home and buy the meal for the day and then go back and prepare it. But the consistent theme that I heard from the leader of Dehogevik is just live normally, because people with cognitive decline, as I just said, the change, the big institutions, the bright lights and the noise is terrifying. So if you give people a very familiar surrounding, then everything is calmer. People are happier and healthier because they're outdoor in nature, and their lives just seem to unfold in a much calmer fashion. There's less need for antipsychotic medication, for example. If I can give you one more example, and this one is quite unique. This is a home called Carroll Woods down in North Carolina, just outside of Chapel Hill. They have a really unique philosophy there, and it's 120 acres in a forest of soaring oak trees. You couldn't find a more beautiful surrounding. There are a lot of people there who have just retired. They're university professors or professionals, and so they live there. But there's a really strong philosophy around inclusion for people with dementia. So instead of, again, leaving people with cognitive decline at various levels inside locked units, the goal is to allow people to move freely and openly, and then everyone is, in a sense, expected to look out for their neighbor. Now, there are also other safeguards in place. People will use technology to track someone. But when I was down there, I met people who had somewhat significant cognitive decline, but they were out digging in the gardens and having conversations, and they were having a life, and a good life, and a normal life.
Thank you very much, Moira. So I think your book tells us that there are some very positive answers and outcomes for long-term care. And I would say that CARP is in the business of getting us to those outcomes. As an investigative journalist, you come across these situations that we have found in Canada, and they're historic issues. How does awareness translating to advocacy with a group like CARP, translating to political change and will to change through someone like Mr. Singh, who was on with us today, how do you see the goals being achieved from awareness to advocacy to political change to those final positive stories that you reveal in your book? How do we get there? What's the path for us?
It's not easy. And I have thought that change would happen quickly in the past, and I was wrong. So I'm always very wary. But I think now there has been a reckoning through the pandemic. And there's a very strong awareness among all citizens of all ages, I believe, because of what we've seen happen in long-term care, the other piece of it, and my book deals with this, the need for social connection and how incredibly valuable that is as we grow older. But so many of us have lived through isolation through this last year. And I think there is among many a greater empathy and understanding of how important that is, because we've seen people in long-term care and retirement homes wither, not just from COVID, but from loneliness. And we know that that is physically detrimental to us. So there just seems to be a greater understanding all around. So how do you channel that moving forward? Well, CARP, big advocate for change. The voices need to rise. And I think now is the time. I don't know that if we held on for another few years or 5 years, if the momentum could be there. But I think politicians and homes have to be held accountable, because there truly is a reckoning now. What we've seen is not the way we want to live. You know, the first wave of boomers is turning 75 this year. They have changed society throughout their lives. And I think the attention now is suddenly turning to long-term care where it may not have before. But that powerful demographic with the voices of powerful advocacy groups can lead to change. But I also think I've been speaking to some political, wise political insiders, I would say, about this. And they sort of talk about, how do you hold politicians accountable when, as was discussed earlier, you know, the feds and the provinces don't seem to be connecting, don't seem to be aligned. And they discuss sort of a strategy behind that, and talking about, you know, the federal government can bring in national standards and can tie funding to good outcomes, proper outcomes that actually include wellness of residents and their emotion and their access, the human rights actually to live with access to the outdoors, to social interaction, and so on. You can include that in national standards that can be turned into regulations, but the politicians can be held accountable. The federal government, as this political sort of strategist told me, could be free to say and have a win, you know, we're going to do this no matter what. So, you know, you need to sign on, but if you don't, these other provinces will sign on and take our money. So I think there's a way of trying to, perhaps with more sophisticated political strategists than I might be as a reporter, but a way to make this a win for everyone.
Thanks. I wanted to bring in my colleague, David Kravit. David is a member of the CARP board, and he's also the Chief Marketing Officer for CARP, and he's been leading our charge to change the long-term care minister right now in Ontario, and has been with CARP for, I think, the longest of anyone on the current board. And he has seen the issues over the years, and recently the Toronto Star published the history of the long-term care conundrum in Canada. Well, David, maybe just if you could weigh in on what we're talking about here.
Well, we have 7,000 signatures demanding that Doug Ford fire the Minister of Long-Term Care. And I wanted to ask this question to Moira, but also pose it to the whole group online, that we feel the future of this file is to demand accountability for results. It's not just, oh, if only we came out with the right policy, everything would be fine. So I got a right-wing party, I got a left-wing party, I got a middle-wing party. What's the policy? What's the policy? The truth is we don't appear to have anybody that can execute. They just can't deliver the goods, even when there is no ideological gap. If you look at the long-term care homes in Ontario, there really isn't a conservative position on whether seniors should suffer or not versus the Liberals versus the NDP. It's a failure of the people running the system to be able to deliver even the basics. And I have a question for you. You've talked to all these political insiders. Bluntly, do they think we've got the horses inside the system to be able to fix it? Because as an outsider looking in, and you look at the horrific results, everything from purchasing the vaccine to running the homes to spending the summer as they did in Ontario, 600 buildings, 180 inspectors, not one surprise inspection when the first wave of COVID died out, not one inspection to say, gee, let's get ready for the second wave. Let's send an inspector into every single building to make sure we're ready. Nothing, zero. So my question, Moira, and I'm not putting the burden on you to solve it, but is it your impression that the career bureaucrats, the people actually managing the system, have the chops, frankly and bluntly, to be able to fix it? Because we're skeptical.
I've heard, when I talk to people from the industry about Ontario, I've heard that there is a lot of interest from the bureaucrats in creating some change. That's interest. So, you know, the seed has been planted. Is there the political will? That's the other question. And, you know, the bureaucrats can put forward all sorts of ideas and get behind them, but you still need your political masters, so to speak, to push forward on that. That's the big question. I was speaking with someone the other day who is in the long-term care industry in a high-level position, and they are not sure that that will happen. They're still very concerned that it looks like Ontario is focused on developing more beds in big buildings, especially on hospital grounds, and not really looking at the idea of a continuum of care, which you spoke about earlier, related to better home care, better day programs. Day programs can stave off long-term care, and they're for the families as well. They can make everything better for a significant period of time to alleviate a lot of stress for families. But this whole continuum of care doesn't seem to be getting the attention that it needs in this individual's mind. The whole point of this is, at least from my philosophy in my book, is that the current system is a toxic system. It doesn't work. It's a failed system. And so we can add more inspections, we can add you know, more fines, but we're trying to control a system that is completely flawed to begin with. And if we went through the transformation that you're aware of and that I've written about in many different ways, that would change things dramatically. And then we can start really working on it. But how do we get to that place is in a sense what you're also asking. And I think the government needs to see what's possible. I think a lot of people are afraid. You know, I've talked to people in both the private sector and the not-for-profit sector who say, we don't know how to do that. We don't know how to create that change. Or they're still building homes. They're getting funding to build homes that have these 32-bed units that are basically hospital wards, essentially. That's what they look like. Those do not help people who live in them, and they don't help the workers who live in them. So we're continuing to build this very old, what people describe as a toxic system. And if we stop that through standards federally that could be implemented as regulations provincially, and opened up the Ontario, I'll use Ontario as an example, the Ontario Long-Term Care Act, which is quite old now, it's 2007. It needs to be updated and make those changes in there. And then with this promise for 4 hours of daily care, there could be more staff on site, but those workers still need to be trained in these philosophies. Otherwise, they're still just operating in the status quo. And that's what we can't forget, is that 4 hours of daily care is great, but it's not the end point. It's just the beginning point.
Yeah. And just one last point, and if they want to make clear, everybody online, particularly other chapters, we're pushing this in Ontario specifically with this minister, but it is a national issue. And our philosophy of looking at actual results and holding the people in charge accountable for those results is a national concern. And we want to hear from all of our chapters and all the people online of examples in your particular province. We're not just, you know, doing this for Ontario. Thank you.
Thanks, David. I wanted to bring in Kathy Wright from the Ottawa chapter. Kathy had a question online. I've made her a panelist. If you just unmute Kathy, you'll be able to ask the question directly. Otherwise, I'll read the question.
Okay, thank you very much, Anthony. Hi, Moira.
Hi.
Anyway, thank you, first of all, so much for all you've done and all your pieces that have really inspired so many people to do more advocacy. So I have a couple of questions, but if I only had one, it was really to ask you, our understanding here in Ottawa is that the homes now that have embraced the transformative culture change, and in Ontario, for some reason, they all seem to be butterfly homes and not the Eden model, but they are experiencing cost savings over the first 24 months that is kind of netting out the expense, because everybody says, oh, it costs so much money and we need so many more staff, we can't possibly do it. But these homes are saying, no, we've actually, done it because of all the savings with staff sick time and, the no supplements and some of the things you've referred to. Was that your experience with some of the homes that you visited in other countries?
Yes, I think the outcomes are all the same, really. Better sleep, better health, happier residents, happier workers. So it's ultimately all the same. And to your point, and you make a really good point, because I was talking to someone else recently about this, and they were saying that they've saved so much money from the layering of all these different programs that are actually quite expensive when you add them all up. If you took the cost of all those away and added in one of these transformative programs, you would save money right there. That could help with the cost of implementing the change right there.
Right. Could I have one more comment, Anthony?
Yes, please, Kathy, go ahead.
Okay. So one of the things that we're discovering, for instance, in Ottawa here, the city of Ottawa has they run 4 municipal homes, and they put in a motion now that will go to one of the committees next week, that they're asking the staff to present a plan to bring in transformative culture change to the city's 4 long-term care homes, which is tremendously exciting. However, I think one of our issues is, we've been meeting by Zoom with many of the councillors and some of the politicians, and I think one of the big issues is they don't understand long-term care. They really don't, and they assume, number one, that it's going to be way too costly, that it won't work, that they have to build all new buildings. There's so much misunderstanding about this kind of change. So I think things like, your book and your presentations, and that probably, in my view now, what we're seeing is that maybe we need to do more real educational or one-on-one with the politicians, or whatever we can manage, as many people from CARP as possible, to try and tell these people and to show them. There are now 11 homes in Ontario that have either implemented or in the process of implementing the butterfly model, and they're all experiencing better outcomes. So, this is kind of a mystery as to why more people aren't talking about it and why they're not looking at these homes.
So maybe to make that a question for Moira, will this light that has been shone so brightly on long-term care across the country in the face of the pandemic and the thousands of deaths of the cohort, is that enough impetus for political change?
It has to be, or else there won't. It has to be, or else there won't be any change. So it must be. And I think what Kathy and her group are doing in Ottawa has been very, very helpful for their area. They've been advocating very strongly on this, and that's what it really needs. But there are also people out there who are running these homes and programs who are very open to conversations with others about their successes. There's sort of this energy amongst these people, and they want to share it. And they're very interested in the work that they're doing, and they want to expand it.
Okay, I'm looking at the clock, and I think we've almost reached our time. I'm going to go back to gallery view so I can see our people on the screen. And if I have any further questions from our gang, I don't see a hand up. So Moira, just one last.
Brody has her hand up, Anthony. Carol Ann.
Oh, Carol Ann, you didn't make the screen. Here we go. Carol Ann, if you unmute yourself. Carol Ann's in Winnipeg CARP chapter.
I am. And, Moira, you made a comment about long-term care workers and the work of value. And I do think that one of the reasons we're having trouble attracting workers to long-term care is that what they're getting from the outside is that they're not of value. Now, other than throwing money at the problem, which I guess if you're a hockey player, that might work. But, and I do agree that they need to have a good, decent wage. Do you have any ideas as to how we can change that perception?
I think by talking about these options that are available. So talking about what's happening in Ontario with Butterfly, in Saskatoon at the Sherbrooke Community Center, they use the Eden alternative, and workers are very, very involved at all levels of workers. So again, the flattening of the hierarchy, you're not made to feel bad because you're a PSW and not someone with a different level of medical education. And PSWs are given the freedom and value to actually emotionally work with their residents in care, and they're upheld for that. And so I think more stories about that would attract people. There are people who are naturally attracted to the caregiving industry, but they become exhausted and tired and worn out by many different facets of it. I'll give you an example in Atlanta, Georgia. This is a privately operated home actually, but they use Butterfly, and they really wanted their workers to be self-motivated in how they connected with the needs of the residents. So there was one older woman, her name was Priscilla, and every night she would get up, she would go to bed, and then she would get up and walk around because she couldn't sleep. And so eventually, as the program came in and her worker became more confident in her ability to take action on her own, she brought in her pajamas and put them on, and then she ended up crawling in bed with the woman and, kind of like putting her arm around her and comforting her. And I just thought, wow, because so many people spend their adult lives with another person, going to sleep, hearing, I think I wrote, the breathing of another person, just naturally. And that's what this woman needed. Her family was fine with it. And then one night the workers were looking for this individual worker, and they found her eventually. She was asleep in bed with the resident. They had both fallen asleep, but the home didn't care. They said, we just had to laugh about that because it's all good. So that's just an example of the freedom that you can have without the fear of not meeting your tasks, not meeting your schedule, and just providing emotional care.
Thanks, Moira. Now, I just had a note that not everyone is familiar with what the term butterfly means. So just before we wrap, can you just go back a little bit and tell us what that is all about?
Butterfly was a UK-based model. It's actually, the name has been changed. It's been sold since I wrote about it in 2018 for the Star, and I wrote about the Peel Region home that went through the transformation. It is a model of care that really transforms the home. They give in-depth training to everyone from the administrator of the home to the housekeeper, and everyone is expected to be hands-on with the residents. So I've seen housekeepers who would normally be expected to empty out garbage and mop the floors, spending time sitting, laughing, joking around, or playing board games or something with residents. And so it really focuses on the feelings of the individual resident. Feelings matter most, as they're saying. And because people with cognitive decline often revert to earlier memories of a time in their life when there was just a lot more activity or action going on, they work with them through those moments and they meet them where they are at the time. Instead of trying to drag them into the here and now, they go with them through that moment.
Thank you very much. I've just posted on the Q&A in the chat a link to your book and the discount code for CARP members. So tell us a bit about your book and where they can get it. And alternatively, they can press the link in the Q&A in the chat and enter the code CARP to save 40% off the cover price. So thank you very much for that offer. And just if you hold up the cover, if you've got it there, and so people can see it on the shelves as well.
Oh, okay.
Well, there it is, Happily Ever Older by Moira Welch.
My book is available at all bookstores, at Indigo and any online bookstore or your favorite local bookstore to support the independents. And I started working on it in 2018, just after I finished the STARS investigation. into the Peel Region butterfly story, and I started traveling across North America and into Europe. And it looks at the continuum of care in a sense. It looks at long-term care in terms of nursing homes and retirement homes and day programs. And it also looks at the leaders of these homes who are constantly innovating. And I think for me, one of the most inspiring pieces of it was that they're never afraid. They don't get stuck in a rut and say, okay, I accomplished this and that's it. They are constantly questioning themselves and could I have done better? How can I change now with the times or with new research? And so if they're not defensive, they're always moving forward.
Terrific. Thank you very much, Moira. Terrence, I see, do you put your hand up there, sir?
Yes, Moira, I think you should send a copy of your book to Jack Mead.
You know, I would like to. I need to get his address.
That's just my 2 cents.
Thanks. We'll share that with you, Moira. Bill, any final words before we say goodbye here, sir?
No, not really, except to thank all the people who have stayed with us. Of the over 600 that were on board, we still have over 400 of you with us, even though we went overtime. And to remind everybody that Anthony has told us that this will be available recorded online. So you'll be able to get other members of your family, your chapters, your community to look at it and get some of the learning that the rest of us did today. So thank you for the team for putting this together, and thank you for everybody for taking the time to watch.
Well, thank you very much, Bill. Thank you, Moira. Thank you to all our elected and newly elected board of director members. Thank you to Moses and all of our volunteers who joined us today, and the 600 who joined in the first virtual meeting of CARP. Thank you very much, everyone. Thank you, Moira.
Thank you very
much. And with that, we'll end the meeting and thank you. See you all again soon.
Bye,
Bye-bye.
everyone.
Bye.